Believe it or not, the quality of your hearing can directly affect the health of your mind. And here to explain how that works is audiologist Dr. Judy Hutch. Thank you so much for joining us again.
Hi, thank you for having me.
So why is hearing so important for your cognitive health?
Well, if you think about it, our brains need as much information as possible. So with our eyesight, with the blood flow, and with the hearing, everything that we can get up to the brain, the better for it to process. And so we've just noticed over time that even with mild hearing losses, that people are showing cognitive decline. We kind of thought for a while that it was mimicking cognitive decline, but the Lancet report over the past 5 years has connected hearing loss and not treating it in terms of our cognitive decline. It's the largest factor that we can control out of 12 items if we actively help our hearing, then our brain gets the information, and therefore we remember more, we have less effort. There's just a whole bag of good if we treat that hearing loss.
Well, I'm sure that's something people generally haven't thought about before, and you have a new FDA-cleared cognitive screener that you've implemented in your office, right?
We do, and it's right behind me, the CogniView Thrive. It screens several layers of executive function, short-term memory, and you don't have to hear well to do it. It has found to be a better tool than some of the others that we've used, like the MoCA for screening cognition. If somebody does poorly on it and they have a hearing loss, then we can look at how to get the information better to their brain through the hearing aids, either new ones or the ones that they've already have. We have a really fantastic hearing assessment function test battery to make sure that people do well with the hearing aids they're in too. But the CogniView has been found with test-retest reliability over and above a lot of the cognitive screeners out there.
Certainly one of the things that sets you apart from other practices across the country. What other types of exams can you delve into to give people a better idea of how you specialize there?
So we do a functional hearing assessment, and all of us are familiar with when you hear the beep, press the button or raise your hand or say yes. But we need to go beyond that, beyond the traditional hearing test, and we want to look at how the brain processes information. So we also want to check to see how you tolerate noise, how you hear a noise, how much effort are you putting in those situations, and if you're processing, if there's too much of your brain taken because of the hearing loss, and you get frustrated, and most of this shows up in noise. So most people will say, well, I do fine until I go into a restaurant or a noisier situation, even Home Depot. And so we put people through a series of tests with and without the hearing aids, as well as real ear measurements, to make sure that people have audibility and comfort. But we're one of the few across the nation that is really bringing in all of this cognitive information as well.
Yeah, the more details you have about a patient's situation and their health, the better you can diagnose anything that's going on. Very quickly, talk about the safety precautions you've taken to keep everybody safe during this time.
Well, we've spread out the appointments a little bit. We haven't unlocked the door, so patients call when they drive up. We have I couldn't figure out how to wear my mask and get my microphone on, but we do have a fantastic supply of the clear mask so that people can watch our lips as we speak to them. And we have medical grade air purifiers in the booths and in the rooms. and just space people out every 15 minutes to make sure that we get the air circulated through and cleaning all of the surfaces. And we just all wear our masks all the time. In fact, this is probably the first time in the office in months that I've gone without a mask.
That's great to hear. A lot of very helpful information, Dr. Judy Hutch. Thank you so much for joining us again.
Thank you, Alex, for having me.
And if you'd like to learn more about the hearing assessments at Oro Valley Audiology, visit hereintucson.com or call 520-825-4770.